Video presentation from the Department of Panchakarma, Sindagi Sri Shantavireshwara Ayurvedic Medical College and Hospital, Haveri. Applied Panchakarma in Diabetic Neuropathy. The contents are Introduction, Classification, Pathophysiology, Symptoms, Samprapti Ghataka, Ayurvedic View, Investigation, Chikitsa, References, Adopted Panchakarma, Conclusion. Introduction. Uncontrolled chronic hyperglycemic condition can cause damaging effect on organs such as heart, kidney, eye, and nerve, leading to the vascular complications. Diabetic neuropathy is one of the common microvascular complications affecting the majority of diabetic population worldwide. It is characterized by degenerative neural loss due to the alteration in nerve damage and repair process, which results in progressive loss of sensation. The prevalence of diabetic peripheral neuropathy ranges from 16 to 87%, with the painful diabetes related to neuropathy about 26%. The lower limb amputation is 10 to 20 fold more common in diabetic patients as compared to non-diabetic patients. The significant neuropathic pain occurs in 7.5 to 24% of all patients with diabetes. Chronic hyperglycemia contributes to the pathological changes like demyelination of nerves, narrowing of neural capillaries, axonal thickening, neural damage, and loss of nerve fibers. The nerve damage can be contributed to the elevated levels of oxidative stress and advanced glycation end products in the nerves. Depending on the affected nerves, symptoms of diabetic neuropathy can range from the pain and numbness in the legs and feet to the problems in the digestive system, urinary tract, blood vessels, and heart. Classification. Diabetic neuritis is classified into mainly two types: somatic, autonomic. In the somatic, polyneuropathy, mononeuropathy. In polyneuropathy, symmetrical and asymmetrical. Symmetrical is sensory, asymmetrical is motor. In mononeuropathy, it includes mononeuritis multiplex. The second one is autonomic. It includes cardiovascular, gastrointestinal, genitourinary, pseudomotor, vasomotor, pupillary. Pathophysiology. Firstly, narrowing of small blood vessels takes place that leads to the development of blood vessels abnormalities like capillary basement membrane thickening and endothelial hyperplasia, and that leads to the metabolic and inflammatory changes like increased oxidative stress, buildup of glycation end products, increased activity of polio pathway, and activation of pro-inflammatory mechanism, and that leads to the diminished oxygen tension, that is hypoxia, and the neural ischemia occurs. Finally, a well-established characteristics of diabetic neuropathy occurs. Symptoms. There are four main types of diabetic neuropathy. Symptoms will be depending on the type and which nerve are affected. Usually, symptoms developed gradually. Peripheral neuropathy. This is a distal symmetrical peripheral neuropathy. It is the most common type. It affects the feet and legs first, followed by the hands and arms. Signs and symptoms of the peripheral neuropathy are often worsened at the night and may include the symptoms like numbness and reduced ability to feel pain or temperature changes, tingling or burning sensation, sharp pain or cramps, serious food problems such as ulcers, infection, and bone and joint pain. Increased sensitivity of touch. Next, autonomic neuropathy. The autonomic nervous system controls your heart, bladder, stomach, intestine, sex organs, and eyes. Diabetes can affect nerves in any of these areas, possibly causing postural hypertension, resting tachycardia, fixed heart rate, dysphagia due to the esophageal atony, abdominal fullness, nausea and vomiting, unstable glycemia due to delayed gastric emptying, nocturnal diarrhea, fecal incontinence, constipation, and genitourinary symptoms like difficulty in micturition, urinary incontinence, recurrent infection due to atonic bladder, erectile dysfunction, and retrograde ejaculation. Pseudomotor symptoms like gustatory sweating, nocturnal sweats without hyperglycemia, Vasomotor symptoms like feet feel cold, dependent edema, bolus formation, pupillary symptoms like decreased pupil size, resistance to mydriactis, delayed or absent reflexes to light. Next, proximal neuropathy. This is diabetic amyotrophic, often affects the nerves in the thighs, hips, buttocks or legs. It can also affect the abdominal and chest area. Symptoms are usually on one side of the body but may spread to the other side, like severe pain in the hip or thigh or buttocks, eventually weak and shrinking thigh muscles, difficulty in rising from the sitting position, severe stomach pain. Mononeuropathy. Either motor or sensory functions can be affected within a single or peripheral or cranial nerve. Unlike the gradual progression of the distal symmetrical and autonomic neuropathies, mononeuropathies are severe and of rapid onset, but they eventually recover. The nerves most commonly affected are third and sixth cranial nerves and femoral and sciatic nerves, rarely involved of other single nerves, resulting in paresis and paraesthesia in the thorax and trunk. Nerve compression palsies commonly affect the median nerve, giving the clinical picture of carpal tunnel syndrome, and less common the ulnar nerve. Lateral popliteal nerve compression occasionally causes the foot drop and may also include the symptoms like difficulty in focusing or double vision, aching behind one eye, Bell's palsy, numbness and tingling sensation in hand and fingers, weakness in hand. Samprapti Gataka. Dosha, Vata, Pitta, Kapha. Dusha, Rasa, Rakta, Tvak, Mamsa, Meda, Vasa, Ambulasika, Majja, Shukra, Ojas. Agni, Datvagni Mandata, Shrotas, Raktavaha, Rasavaha, Medavaha, Mamsavaha, Majjavaha, Shukravaha. Shroto Dusti, Sangha and Vimarga Gamana, Udbhavasthana, Hasta Pada, Sancharasthana, Sira Damani, Adhisthana, Raktavaha, Medavaha, Shrotas, Vyaktasthana, Hasta Pada, Daha, Kriya Alpata. Ayurvedic view. The disease diabetic neuropathy cannot be directly correlated with any Vyadhi of Ayurveda, but similar lakshanas are present in Purvarupa and complications of Prameha. In diabetic neuropathy, mainly lacinating pain, burning sensation, tingling sensation, and numbness in the hands and feet are symptoms. Symptoms of diabetic neuropathy includes Ruja, Daha, Harsha, and Supti. Ruja. The word pain signifies ruk. Any kind of pain is always associated with Vayu. It includes under Vata Prakopa Lakshana by Ashtanga Hridaya. Daha. The word burning means Daha. Any type of Daha always associated with Pitta. Here, Pada Daha is due to Ashyapakarshaka of Pitta by Vata. Harsha. Harsha is included in the Vata Nanatmaja Roga. Chinchimayana means tingling. Here, Chala Guna of Vata is responsible for Harsha. Supti. Supti means numbness. Supti is a symptom of Snayu Sira Kandara Dushti. Supti is described in the Vata Nanatmaja Roga. In Ayurvedic classics, symptoms like Suptata and Daha in the body parts, especially in hands and feet, are described as a Purvakarma of Prameha. These symptoms are present in complications of Prameha. Similarities of diabetic neuropathy and Vata Rakta. Symptoms and Samprapti, complications of Vata Rakta, has nearly resembles with the symptoms and pathogenesis of diabetic neuropathy. Etiological factors, predominant symptoms and complications of Prameha and Vata Rakta are also nearly same. Excessive use of Katu and Tikta Rasa, excessive walking, excessive exercise to treat Madhumeha leads to the pathogenesis of Vata Rakta. Micro and macrovascular changes and neural ischemia are the main pathology in diabetic neuropathy, which are similar to the Rakta Dushti and Vata Dushti of Vata Rakta. Investigations. Neuropathy is diagnosed on the basis of symptoms and a physical examination. During the examination, blood pressure, heart rate, muscle strength, reflexes, and sensitivity of the position, vibration, temperature, or the light touch is checked. Comprehensive foot exam, electromyography, quantitative sensory testing, a check of heart rate variability, ultrasound, nerve conduction study. Adopted Panchakarma and diabetic neuritis. Treatment. Nidana Parimarjana is the main chikitsa of every disease, Samshodhana and Samshamana. Shamana. All the Ayurvedic acharyas explained about Nidana Parimarjana as Kapavardhaka Ahara Vihara should be avoided. That is Madura, Shita, Snigdha and Guru Ahara. Shamanaushadha. Ayurvedic anti-diabetic formulation along with the Tridosha Shamaka herbs, especially Vata Shamaka, Shotahara properties due to its diuretic nature. Nadi Balya, Vedana Stapaka, useful in the state of diabetic neuropathy. Bala, Atibala, Ashwagandha, Tilataila has emollient nourishing property and may act by its myelin sheath repair property and nourishes the snayu and improves its action. All these drugs have the property of Vatanashaka and may improve the myelin sheath repair property and the nerve conduction velocity, which has a result in overall improvement in the total health, especially neurological health of the patients of diabetic neuropathy. Activities like lack of exercise, laziness, sedentary habits must be avoided. Shodhana. In Panchakarma, purification of the body leads to maintaining their equilibrium. Initially, Mrudu Snehana is done, followed by Shastikashali Pindasvedana. Then, Samshodhana is done by Vamana, Virechana, Nasya, Basti, Shastikashali Pindasveda, Patra Pindasveda is useful in treatment of diabetic neuropathy. Udvartana. In the pathogenesis of Prameha, it is mentioned that due to the Bahudravya Sleshma, the sthirata of the muscles of the body is lost. As Udvartana is a procedure that decreases the kapha, liquefies the medas, imparts sthirata to the body and helps in Tvakprasadana. Udvartana is aimed at improving the initial langana and sensitizing of the skin by increasing the circulation. Triphala Churna, Triphala and licorice, Kolakulatadi Churna, Nishamalaki Churna can be used in Udvartana procedure. Abhyanga. After the initial Rukshana by Udvartana, Abhyanga should be done with oil which is Vatahara and also indicated in Prameha. This process elevates Vata and improves the sensory perception of the skin as Vayu dominates the tactile sensory organs located in skin. Example, Kshirabala Taila, Mahanarayana Taila, Dhanvantara Taila, etc. Basti. Basti can break pathogenesis of Vata Vyadhi by removing Margavarodha by purification of channels and Dhatukshaya by its Brahmana property. Basti used in the case was mainly made of Tiktarasa and Madurarasa. Mahapanchatiktaka Grita and Ashwagandha Taila were used in the formation of Basti. Tiktarasa is used in the treatment of Rakta Dosha and Raktavaha Shrotodushti. Tiktarasa has the Shrotagna and Pittahara properties. Grita and honey has Madurarasa dominance. The combination of these drugs may act as Vata Pittahara that may reduce inflammation and treat the diabetic neuropathic condition. Hence, Basti used in the case was effective for the treatment of diabetic neuropathy. Rasayana, Ashwagandha has immunomodulatory and Balya properties. Patya and Apatya. Shama, Kodrava, Udalika, Godoma, Chanaka, Adaka and Kulatta, which are suitable to be used as a food by patients of Madhumeha. Vegetables of bitter taste, meat of animals and eggs of birds of desert-like region, boiled yava and its preparation, mudga, shali and shastika shali are all suitable as foods. Saviraka, sura, buttermilk, oil, milk, ghee, jaggery, foods processed with source, sugarcane juice, foods prepared from flour, meat of animals of marshy region should be avoided from use. References: Shushruta Sutrasthana, Charaka Sutrasthana, Charaka Nidanasthana, Charaka Chikitsasthana, Ashtanga Sutrasthana. Conclusion: Ayurvedic management, including therapies like Churna Pindasveda, Jambira Pindasveda, Patra Pindasveda, Matra Basti, Shastikashali Pindasveda, alongside specific Ayurvedic medicine, dietary and lifestyle adjustment has shown promise in elevating symptoms and improving patient well-being. By integrating Ayurvedic approach with modern medicine, we can better manage these chronic conditions and enhance the quality of life for those affected. Thank you.